Hi everyone, a blessed day to all of you. So today we will discuss oral care. Actually, this is the lecture part of your oral care. So in each skills, we divided it into two parts. So the first part is the lecture and the second part is the demonstration. So magkahiwalay ang video na ginawa namin per skill. And we have 6 skills for this week. So oral care is just one of the topic among those 6 skills that you need to review, you need to memorize, you need to apply, and not just by memorizing is, of course, you need to understand. Okay, you need to study. Okay, so oral care, providing oral care. So what is the purpose of providing oral care? O Valentine's nung nakaraang araw. So may mga jowa dyan, of course, kailangan yung mag-toothbrush, di ba? Okay. So what is the purpose? Bakit kayo mag-toothbrush? Okay? That is to decrease microorganisms in the mouth and on the teeth, di ba? Kung ano-ano yung kinakain nyo. So, kapag hindi kayo nagtutoothbrush, nagstay yung mga food residue dyan sa inyong mga mouth, and of course, later on, magkakaroon ng microorganism dyan that might lead later on into certain diseases. Okay? Of course, to reduce the risk of cavities and mouth disease. So, na-mention ko na yan. Kailangan mong gawin yun is, of course, para hindi ka magkaroon dyan ng mga oral cavities and other mouth diseases, mouth sores, and etc. To decrease the build-up of food residue on your teeth, of course, pagka nagkaroon yan ng mga food residue, it may lead to formation of cavities or mouth diseases, diba? And to improve appetite and taste of food. Sige nga, subukan nyo nga na hindi kayo nagtutoothbrush ng ilang araw, tapos kakain kayo, diba? So, the more na walang panlasa, lalo naman sa ating patient, diba? Yung mga patient natin na may sakit, na they're not capable of doing the activity of daily living, yung even a simple doing the oral care, hindi nila magagawa. So, syempre, iba na yung, magiging iba yung panlasa nila, nawawalan sila ng appetite. So, dahil din nagkakasakit sila. Of course, kapag pinoprovide natin yung oral care, the patient will feel comfort or comfortable. So, kapag comfortable sila, maganda ang kanilang pakiramdam. And, of course, gaganahan din sila. There is a possibility na pwedeng gumana kanilang panlasa. Okay? And another one is, of course, to stimulate circulation on oral tissues, tongues, and gum. Paano na ipopromote ang stimulation of circulation? Is, of course, tinutoothbrush mo yan eh. Actually, kapag unconscious yung patient natin, later makikita nyo that we are not using the usual toothbrush that we use at home. So, cotton buds or padded tongue depressor lang yung gagamitin natin. And then, pag ginagamit mo yun is, of course, namamassage mo rin yung gums, yung tongue, yung mucosa dyan sa area ng mouth. And, of course, napapromote mo yung circulation dyan sa area na yan. Kapag magandang circulation, maganda rin ang healing. So, hindi magkakaroon ng mouth sores si patient. And, of course, to improve appearance and self-esteem. Diba? Ikaw, kapag hindi ka nagtutoothbrush, ano ang feeling mo? Diba? Parang pakiramdam mo, hindi ka comfortable. Parang nahihiya kang ngumiti. Kapag nasa school ka, wala ka dalang toothbrush. Halimbawa, nasa school ka, after eating, hindi ka nakapag-toothbrush, ayaw mo ngumiti, ayaw mo rin magsalita kapag kinakausap ka ng classmate mo, dahil baka himatayin yung kaklase mo kapag nagsalita ka. Okay? So, in providing oral care, ma'am, napakasimple lang yan. Pagtutoothbrush lang ng patient. Oo, that is very simple task nga or procedure. But, of course, it will help your client. Diba? Malaki ang tulong niya sa client. Mapopromote nga yung kanyang circulation, yung self-esteem niya, and ma-avoid mo yung further complications or other illnesses like mouth sores, cavities, diba? So, from that, napaka-importante din ng oral care na ipoprovide natin to our client, especially those clients who are unconscious or those clients na even though they are conscious pero limited ang kanilang movement. Okay. Kahit oral care yan, you have to utilize your nursing process. You need to apply your nursing process in each procedure that you will perform in nursing. Okay? Paulit-ulit kong minimension sa inyo yung 5 steps of nursing process, wherein yung first step is the assessment part. Okay, of course, you need to assess the client before doing the procedure, before providing oral care to your client. You need to assess the client's desire and the need for oral care. So, gusto ba ni client na gagawin mo yan? Or may need ba for oral care? So, even your client is not conscious or your client is unconscious, sabihin mo, unconscious naman yan, hindi na hayaan na lang natin yan siya, o hindi na kailangan mag-toothbrush yan. Of course, the more na unconscious yung client, sinasabi nga natin that once you perform the oral care, you can stimulate the circulation na pipreventin yung further diseases or yung mga mouth diseases. So, kahit unconscious si client, makikita mo dyan, dahil unconscious si client, he or she is not capable of doing oral care for himself or herself, so you need to provide oral care for the client. Or kapag conscious naman si client, you have to ask the client. Okay, baka naman may insulto si client na bigla mong sabihin, tututbrushan po kita, diba? Parang sinabi mo, baho ng hininga niya. So you need to assess the client's desire. Okay? You need also to assess the client's usual routine for oral hygiene. So, ano ba ang usual routine ni client? Ano ba, tuwing kailan siya nagtututbrush? Every 3 days? Every day? Okay. So, kapag every 3 days or may naaamoy ka dyan, so, probably, hindi maganda ang practice ni client. So, you need to advise your client in a nice way, 'di ba? Yung hindi naman maiinsulto yung client mo, 'di ba? So you need to assess your client also. Okay? Kung ano yung usual routine niya. Kung palagi naman talagang nagtututbrush si client, so baka you don't need naman, hindi porket gwapo si client or maganda si client. So ayan, magpo-provide ka ng oral care, 'di ba? Okay. And then, you assess the client's knowledge of purpose and the procedure. So, if conscious yung client mo, alamin mo, may kaalaman ba siya na why is it important to do the oral care? Baka naman, talagang probinsyano yung client mo na yan, or talagang very hindi nila na ipapractice yung hygiene. So, dapat tuturuan natin sila. So, dito papasok yung health teaching nyo, yung mga strategy nyo, and how to do the procedure, kung paano siya gagawin. Okay? Of course, pag sabi natin you assess the client's knowledge, you are referring to the client who are conscious. Okay? Again. And then the client's ability to understand and follow instructions. So, yung patient mo, conscious nga yan. May ability ba siya to understand kung ano yung tinuturo mo? Why you need to give her or him an oral care? Why is it important to do oral care? So, nakaka-follow ba siya ng instructions? Baka mamaya lunukin niya lang ng lunukin yung pati yung mga mouthwash na lunok na ni client. Okay, you need to assess the level of consciousness ni client. Ano ba ito? Nakakaintindi ba ito yung client mo, especially bata ba yan or sobrang matanda na may Alzheimer's na, you need to check also. So, assess presence of dentures. Bakit? Kasi kailangan, baka mamaya habang tinututbrush mo si client, unconscious yan. May dentures pala, or not only dentures, may loose teeth pala si client. So, habang binabrush mo, naglagay ka pa ng tubig-tubig, ayun, na natulak mo yung kanyang dentures, papasok, baka ma-choke pa yung client mo. So, you need to assess the presence of dentures para, of course, pwede mong tanggalin yan and ma-clean mo rin yung dentures at saka yung oral cavity ni client. Also, assess the status of the palate, the hard palate, the soft palate, kung meron ba yung mga sores, okay, the floor of the mouth, the throat, the cheeks, yung inside portion ng cheeks, the tongues, the gums, the teeth, meron bang loose teeth, meron bang may oral cavities dyan, may mga sira-sira bang ipin, may mga sores ba sa palate, sa floor of the mouth, back of the tongue, sa throat, meron bang mga inflammation, okay, sa cheeks. So, you need to assess that para, of course, kapag may presence na ganun, ibig sabihin, baka may kailangan pa tayong ibigay o kailangan natin i-report to the physician, doctor ni patient, para ma-provide yung proper care for the client. Kung kailangan ba ng may medication bang kailangan, kasi baka nag-start na ang infection dyan, kaya nilalagnat si patient dahil may infection na pala, may tonsillitis na pala, or so, may gingivitis na pala, or may mga infections na dyan. Going back to assessment, you need to understand, no, kahit wala pa tayo, kahit I was not able to discuss it yet, yung nursing process in our fundamentals lecture, but I want you to understand that during assessment, you are gathering data. Okay? Yung data na nag-gather mo is both subjective and objective. Pag sinabi natin objective, it is measurable or nakikita mo. Pag sinabi natin subjective, you cannot measure it, but it is usually reported by the client. Like, nahihilo ako or masakit ang ipin ko, yun, hindi mo naman nakikita yun. Okay, you need to gather. So, once you have your data now, objective and subjective data, you need to proceed to the second step of nursing process, which is your nursing diagnosis. Yung mga nursing diagnosis na ito, makikita nyo ito sa inyong NANDA. Okay, so depende kung ano yung situation, kung ano yung present illness of the client or yung current situation of the client, yung you can formulate your nursing diagnosis from the data you gathered from the subjective. Mas focus natin yung objective data. Okay, so these are just some examples of nursing diagnosis for oral care. Diba? Simpleng oral care lang. Pero you have your data, you have your assessment, and then you diagnose from that assessment. So, this is your nursing diagnosis. Impaired oral mucous membrane related to, so meron tayong related to, inadequate oral cleaning. So, yun ang nakita mo. Yun ang diagnosis mo. May problem doon sa kanyang oral mucous membrane dahil yung inadequate yung kanyang oral cleaning. Bakit kaya inadequate ang kanyang oral cleaning? Baka lack of knowledge yung patient, or baka because the patient is, meron siyang limited movement, or the patient is unconscious. Okay? Then, impaired dentation related to lack of knowledge regarding dental health. So, may mga walang mga ipin dyan. So, may mga sira-sirang ipin, may mga cavities. Yan. So, nagkaroon ng problem doon, maybe probably because the patient doesn't perform proper hygiene, no? Oral care, hindi niya ginagawa. Nagtututbrush siya once a week or every 3 days or pag naalala lang. Okay? So, now, since you have your assessment and you have your nursing diagnosis, ano na yung next na step? Okay? Diba? May 5 step. Okay. So, outcome identification and or planning. Okay? Diagnosis. Okay. Add 5, diba? Assessment, diagnosis, and your planning. Okay, so your planning. So, outcome identification or your planning. So, yung first plan mo is to increase oral intake from 10% to 50%. Kasi nakita mo, kaya pala may problem. Kaya pala impaired yung mucous membrane niya. Kanina napaka-dry ng kanyang mucous membrane. Kaya pala impaired or kaya pala ganun kasi kulang ng water intake, oral intake si patient. Hindi siya mahilig uminom ng tubig. So, ano rin yan? It also affect. Pwedeng mag-dry yung mucous membrane dyan. Okay? Then, ang target mo is ma-increase mo yung kanyang oral intake. Kung kanina, upon assessment, tinatanong mo si patient, ilang glasses of water po ba ang iniinom nyo a day? As sabi ni patient, ay, ano lang po mga 1 to 2 baso lang. Wala po kasi kung ganang uminom ng tubig. Okay. So, from 1 glass or 2 glasses of water, sana ma-increase mo at least 50%. Okay. So, magiging 4 mo man lang or 45 glasses of water na siya a day. So, wag naman natin biglayin. Hindi kailangan 8 glasses of water ka. Medyo masama nga pakiramdam ni patient. Pag uminom siya ng tubig, baka sumakit ang tiyan niya or ano pa yung nararamdaman niya kaya ayaw niyang uminom ng water. So, unti-untiin natin na i-increase. So, at least 50%. Okay? And your another plan is that the mucous membranes and the lips are intact. So, ibig sabihin, kung kanina, during your assessment, although hindi natin nailagay doon sa assessment natin, dapat nailagay natin doon na merong cracked lips si patient, meron siyang dry oral mucous membrane. So, yun yung target mo na at the end, ito yung plan ko from my assessment and diagnosis, kailangan ang mucous membrane in the lips of my patient is intact at the end. Okay? Oral passage and teeth are clean. So, kanina nga, upon assessment, medyo nakita natin may amoy-amoy pa si patient, may mga tinga-tinga pa, nag-yellow ang ngipin. So, at the end man lang, yung oral passages and the teeth are clean na kapag ngumiti si patient, no? May comfortable. So, pwede mo pang idagdag dyan sa planning mo na sana at the end of your shift, the patient feel at the end of the procedure, the patient feel comfortable. Ituturo ko rin yan doon sa fundamentals of nursing kasi yung planning natin, meron tayong short term and long term goal. Okay, so may mga steps din yan na kailangan yung plan mo must be smart, diba? Specific, measurable, attainable, realistic, and time bound. So dapat ganun yung planning natin or yung goal natin. So mas in-depth yung ating discussion probably doon sa ating fundamentals of nursing. I know it's part of fundamentals of nursing lecture. Okay? And then you need to have or you need to check also the special considerations in planning and implementation. So, may mga special considerations tayo. Diba? May i-consider tayo sa ating plan. Example, in general, use toothbrush or toothpaste for client receiving anticoagulant therapy. Ano ba yung mga anticoagulant therapy? Those are medication na nagpapaslow ng blood clotting. So, anticoagulation. So, medication ito na binibigay kay patient na pinapaslow ang blood clotting. Okay? Para hindi magka-form ng thrombosis. Ayan. Or pinapalabnaw ang kanilang dugo. So, those medications are the following. So, tandaan nyo po yun. Heparin, warfarin, Coumadin. Ma'am, why do I need to check the chart of my patient? You need to check the chart of your patient, especially if your patient is unconscious. You need to check of the patient what are the medications, what are his or her medications that she or he is currently taking. Kasi baka mamaya may anticoagulant medication siyang tinitake, tas nasugatan mo si patient. But it doesn't mean na kapag ay ma'am may heparin, ma'am may warfarin, hindi ko na po siya itutoothbrush. You can still do the procedure. You can still provide oral care, but you have to be careful not to lacerate your client, not to cut your clients because it might cause bleeding to the client. Kasi nga, meron siyang tinitake na medication na hindi agad-agad magba-blood clot siya. Okay? And you must dilute mouthwash. Okay, didilute mo yung mouthwash. Pwedeng half na mouthwash and then half water. I-dilute mo yan for the clients with oral lesions and sensitive oral tissues. Kasi baka it might cause irritation, di ba? Or irritation to the client's oral cavity. And then, okay. So, meron pa rin, no, yung considerations natin, especially for the geriatric client. Ano nga ba ang geriatric client? Sige nga, ano ang sagot mo? Okay, geriatric client, ito yung ating mga seniors patient natin. You have to be careful also, no, you have to check dapat may extra care tayo. Especially if this client, meron silang loose teeth due to retracting of the gums. Kasi tumatanda na nga, nagkakaroon ng mga loose teeth kasi nagre-retract yung kanyang gums. And while you're performing the oral care, baka mamaya, yung na-mention ko kanina, natulak mo, natanggal pala yung isang ipin niya, na-choke si patient. Diba? And then, you have to encourage client to perform as much oral care as possible and encourage the family members to assist when necessary. Kasi not all the time naman, itututbrush mo si client. Ma'am, napakarami na po namin trabaho. Napakadami naming workload. Pati ba naman oral care, gagawin pa namin kay patient yan. So, tandaan ninyo, pwedeng magkaroon ng infection si patient, pwede siyang magkaroon ng lagnat, dahil lang nagkaroon siya ng mouth sores dyan sa kanyang oral cavity dahil hindi na siya nababrush or hindi na nalilinis. Dahil matagal lang bedridden si client. So, kailangan gagawin nyo yan. Pero, if you don't have much time, pwede mong turuan ang family members, or if the client is conscious naman, ituro mo yung proper way. Kailan ba dapat nagtutoothbrush? Kailan ba dapat maglilinis? Okay? Then, if the patient is helpless, okay, unconscious or helpless, may limited movement, make certain that the patient's mouth receives care as often as necessary to keep it clean and moist as often as every 1 to 2 hours if necessary. Biruin mo yan kasi pwede kasing magdadry yung kanyang oral cavity, yung mucous membrane dyan. So, it might dry or magkaroon ng invasion of microorganisms that might lead later on to infection to the client. Okay? So, the nurse should wear disposable gloves and normally saline solution ang gagamitin natin in cleaning. You have to moisten the mouth with water if allowed and lubricate the lips with often enough to keep the membranes well moistened. Diba? So, kailangan laging moist yung membrane na yan. A patient receiving chemotherapy medication, our cancer patients, may have bleeding gum. So, madali rin silang magkaroon ng bleeding. An extremely sensitive mucous membrane. So, use a sponge to teeth for cleaning or substitute a salt water rinse. Lagyan mo ng 1/2 teaspoon salt in 1 cup of warm water for brushing of the teeth instead of using a commercialized mouthwash. So, denture care. Denture should not be wrapped in tissue or toilet tissue or disposable wipes because these are likely to be thrown away. Alam mo ba kung gaano kamahal ang mga dentures ngayon? Napakababa na yung 7K. Eh kung maganda-ganda porcelain pa yung dentures ng iyong patient, tas upper and lower. So, magkano kaya yan? Baka hindi yan bababa sa 50K. Tapos nilang binalot mo lang ng tissue or wipes, tapos na itapon sa garbage. Patay ka na dyan. Yung babayaran mo yan. Eh, ang baba lang naman ng sweldo ng kaka-entry na nurse. Diba? So, maghuhulog ka pa. So, you have to be careful. Okay? Denture should be stored in water to prevent drying and warping of plastic materials, especially kung plastic materials ang gamit. Okay? And, okay, umulit lang yun, hindi ko nabura. So, materials and supply. So, you need the following. Padatang depressors, cotton balls, cotton applicators, mouthwash, diluted in water, of course, clean gloves, towel, petroleum jelly to moisten the lips of your client after, a septo syringe, kidney basin, yan. Okay. So, now, these are the procedure. Actually, yung procedure, may another video na for the procedure. And you can proceed to that later. Okay? So, pwede nyo ring tingnan tong aking procedure here kasi merong mga rationale behind. And when you do the procedure, kung yung sa pagpipresent ko doon sa video is more on step by step lang siya, I did not give the rationale. Here, you can check may rationale para when you perform, kailangan meron kayong konting rationale each as a step. Okay? Kung bakit kailangan gawin ang mga yan. Okay, so I will not read it per step since this was already included in your so that's anong part na yon, di ba? Meron kang assessment, diagnosis, planning. So yung procedure itself is your intervention or your implementation. So yung procedure, yan yung intervention or your implementation. And then we will move on to the last step of the nursing process. So nakita nyo na how did I apply, although not in all my presentation ata nilagyan ko ng nursing process, not in all skills. So pinakita ko lang dito sa inyo kung paano i-apply ang nursing process. But you in your own self, kapag gagawin nyo na yung bawat steps or I mean bawat skills, dapat it should be patterned on our nursing process. Yung step ng nursing process natin. So now let's move on to the evaluation part. Kasi na-implement mo na, nagawa mo na yung procedure. So ang tanong natin here is, were desired outcomes achieved? Examples of evaluation includes the following. So, di ba, ang target natin kanina is yung oral intake ma-increase to 50%. So, sabi niya dito, desired outcome met. Oral intake increase from 10% to 50%. And another one, yung another plan mo or your goal. So, desired outcome met. So, mucous membranes and lips are intact after the procedure. Another one, so desired outcome met, yung another goal mo, oral passage and teeth are clean after the procedure. And then, of course, wag na wag din yung kalimutan, ang last, yung itong part na to documentation. Ma'am, ano ba yung documentation? Mula naman yan sa nursing process or ADPI. Of course, documentation, di ba, sabi ko nga sa inyo, what is not written is not done. So, this is part of your charting. So, ilalagay nyo dyan. So, this is example of your documentation. So, the following should be noted on the client's chart. So, ino-note mo doon. Amount of care done by client. So, tumulong ba si patient or talagang totally ikaw ang nagbigay ng care and conscious si patient without assistance by the client. So, client's response to activity, na-irritate ba si patient or did your patient verbalize comfort after the procedure? Okay. What is the condition of oral cavity and lips after? Is it intact? No cuts? Is it moist? Okay. So, eto na siya, no? Sorry, so January 23, 2019. So, dapat na bago ko na to. Of course, kung ano yung recent date, yun yung date mo ilalagay and then time. So, example is oral care performed with client assistance. So, ibig sabihin, conscious si client, siya yung gumagawa, taga-abot ka lang ng mga kailangan ni patient. Client fatigue after brushing back teeth, but express interest in grooming activity. Parang nahihilo daw siya. So, ni-note mo dyan. Mucous membranes moist, lips moist, and skin intact. So, yan yung very important na ilalagay mo sa inyong documentation. Actually, oral care is just very short. Mabilis lang din gawin. So, I'll give you a few minutes only to perform the procedure during your return demonstration. So, thank you very much for your time. So, I hope you learn that even a simple oral care is very important. Not only to our client, but of course, to us. Diba? Kung sino yung natututbrush ng every other day lang. So, importante yan. Kailangan natin linisin yan kasi yan yung point of entry. Diba? Katulad na lang ng COVID-19, di ba? Pwedeng pumasok sa ilong, sa inhalation mo, or sa bibig mo yan, or mahawakan mo yung may mga ganun. So, point of entry ng mga microorganisms, viruses, and bacteria. Pwedeng pumunta dyan, pwedeng magdudumi si patient dahil hindi malinis, or hindi malinis ang kinain, hindi pa nilinis yung oral cavity, or yung mouth ni patient. Okay, thank you, and God bless you all.